Everyone, hello ladies and gentlemen, welcome to CoinNewsExtra weekly virtual blockchain and cryptocurrency panel discussion. Actually, today's episode is the 20th episode. So today we'll be looking at blockchain application in the healthcare sector, and we have healthcare professionals who will be joining us as panelists to discuss about this interesting topic. So we have Dr. Jen Thomason. She is the co-founder and chief inspiration officer, Fintech.tv. Dr. Jen, you are welcome to CoinNewsExtra.
Thank you very much. It's wonderful to be here. And just for your listeners, I actually did a hackathon in Nigeria in 2018. So I've been to Lagos, I've been to one of your co-working spaces and had a bit of a look around.
Yeah, she has very good interest in Nigeria, making impact in the Nigerian tech ecosystem. So joining us also is Ochoche Ubeni. He is the CEO and co-founder of Nimedis ecosystem. Ochoche, you are welcome to CoinNewsExtra.
Yeah, thank you very much. Nice to be here.
It's a pleasure to have you. So I'm Lee, the moderator. So this program is proudly sponsored by MTech and Nimedis, also by Miami University Blockchain. So today we are talking about blockchain application in the healthcare sector. So Ochoche, let me start with you. You are a healthcare professional in Nigeria. So what are some of the importance of the healthcare sector from your own point of view?
Hello, I can hear you.
Yeah, go ahead. Just briefly, just go ahead.
Sorry, I didn't get you. Say again.
Okay, I said some of the importance of healthcare sector in our society.
Okay, importance of the healthcare sector generally.
Yes.
Okay, that's quite broad to say. The healthcare sector, basically, health is wealth. They say, if I'm correct, health is wealth because you need a healthy population to be able to work. So the importance of health cannot be overemphasized. Given the recent pandemic, the COVID-19, it's a clear example how important the health sector is. Without a good health sector, you see what the pandemic did. It puts nations way back economically in time. So the role of the healthcare sector is as clear as COVID-19 has made it. We were brought to ground zero as a result of the pandemic. So I don't really get it when you say the role of the health sector.
You're making points there because the pandemic has really made the work of the healthcare sector more visible. So because when there is an outbreak, definitely is the healthcare sector that will handle it. I just want to have your opinion from there. Dr. Jane, what's the opinion there?
Well, look, I think I want to agree, but even emphasize more, because traditionally, before the pandemic, the health sector is often one of the least considered economically important sectors when government are allocating resources. They like the finance sector, the infrastructure sector, and so forth. And it's often really tough for the health sector to get the funding that it needs. And then when you get faced with something like the pandemic, or other major disease problems like Ebola, then the healthcare sector is simply not ready to be able to cope with the onslaught. They don't have the ventilators, they don't have the PPE equipment, they may be short-staffed. And so it's at a time like this that there's an opportunity for people to really understand how important health is and how important being prepared for outbreaks of diseases are. So, I mean, in a way, even though it's a tragedy, both economically and socially, for people to have the pandemic, for the health sector, it's really the first time in a long time that it's been top of mind for everyone, everywhere. So health, we realise how important health is when it's threatened, and now is the time that we can really make some leaps forward because our health has been threatened. And one of the things we'll talk about today, I'm sure, is the acceleration of digital solutions to healthcare like blockchain.
Yes, interesting. Most especially, we are facing a very big challenge in the world now with the pandemic, and some of the lapses in the healthcare sector have been exposed. So that brings us to another question. So this morning, I will start with you, Dr. Jane. What are some of the challenges facing the healthcare sector generally? You could start from your area or globally.
Well, look, I think the thing is, at the moment, the healthcare sector is obsessed with COVID, and it has to be because this is an immediate challenge that we have. But one of the consequences of that, and I imagine that it's going to be the same in Nigeria, because I certainly was talking to people in South Africa about it recently, is that, for example, if people are locked down, they can't go and get their drugs for other conditions like HIV or TB. So other people, other than those who are being threatened by this current pandemic, are actually suffering as a result of not being able to go and get the medication that they need to treat their other conditions. So it's much more complicated than, everyone's trying to make sure that you've got ventilators and PPEs, because in our country, people who might need certain surgeries, for example, can't get them because the hospitals have been closed down only to accept COVID patients and so forth. So I think COVID has made, a country like Nigeria and other countries in Africa much more dangerous places to be, because other conditions that people suffer from regularly are also not getting treated because of the lockdowns.
Okay, Ocheche, you are in Nigeria, in Africa. You heard what Dr. Jane said. What are some of the challenges, even before the COVID, that are facing the healthcare sector in Africa and generally globally?
Like she said, it's when I was speaking earlier, I talked about the waiting time to see doctors. That was even before the COVID-19 pandemic. It's between 2 hours to 8 and 11 hours, upwards of that, just to see a doctor. So what she said is completely is true. The situation in Nigeria is even more serious, given what COVID-19 has exposed the system to. Because lack of funding, among so many other issues Nigeria was dealing with before the COVID-19 pandemic, like medical brain drain, for instance. We have a population of over 206 million and a total of about 35,000 doctors. So you see the disparity. The doctor-patient ratio is quite little. And a lot of people do not know this fact. A lot of people do not understand that there is a real short supply of doctors in Nigeria. So that is one problem on its own that Nigerians were facing before the COVID-19 pandemic. So I would like to keep what I'll say around that area of not having enough doctors. So it's a complex situation in Nigeria. Talk about policies and funding. Just recently, again, how she said, healthcare has never been a priority for so many nations, but the COVID-19 made people turn and look at healthcare. Even at that, in Nigeria, healthcare funding was dropping in the budget. The last time the former Minister of Health spoke about the funding from the federal government, it was basically lamentations, because other nations are increasing funding for healthcare, but nations like Nigeria are dropping funding for healthcare. So if you look at the demographics and the distribution of diseases and conditions, you will see that Africa has a huge burden of diseases and very few professionals. And even more so, the policymakers are not making it comfortable for these few professionals to want to even practice in the nation. So me being in learning, at some point, my teachers would tell me, study hard, write exams, and leave the country. It's a common statement you find around medical professionals training. Everybody wants to train and leave the country. So it's quite a dangerous situation in Nigeria, not just in terms of medical practice, but for the population at large when it comes to handling or managing diseases, outbreaks like COVID-19, basically.
Interesting. In case you are just joining us, this is CoinNewsExtra weekly virtual blockchain and cryptocurrency panel discussion episode 20. Today we are looking at blockchain application in the healthcare sector. In case you have any questions for our panelists, you can drop it at the question and answer session. So moving straight, we've been able to see what the healthcare is, the role of the healthcare, and some challenges that are facing the healthcare sector. So we are now going to look at how blockchain and other emerging techs are going to be playing a role in solving these challenges. So Dr. Jane, what's blockchain technology briefly, and how can it play a role in the healthcare sector?
So I want to just respond to that previous conversation first, because I think it's really important, this issue about how the health sector is resourced. And I'm sure it's quite correct that the amount of funding is dropping. But what we have the possibility now, and this will be relevant to the blockchain comment, is that technology can transform the way services are provided. So we're already seeing it in the pandemic here, for example, where people went straight to telemedicine consultations. So face-to-face consultations with doctors almost ceased, and people have to go and get COVID tests. But our Medicare system included a payment item number. So if I want to see a doctor, the doctor consult with me over the phone and he can get paid for that. So there was an immediate move to digital. And in so many other ways, trying to monitor patients remotely, digital and the pandemic have allowed some of these initiatives to accelerate, which before, because healthcare is very traditional, and it's controlled by, if you like, thinkers who've been brought up in old-fashioned ways, it's not been one where a lot of innovation's been able to take place. So what I would like to share with you is that the pandemic is an opportunity to build these innovations into the way we think about the future. Because even though your colleague is going to talk about the shortage of medical practitioners in Nigeria and has some really interesting innovations about it, the likely fact is that you will always have a shortage of medical practitioners. So the question is, how can digital technologies enable the skilled practitioners that you've got to be able to cope with larger numbers of people using artificial intelligence and mobile technology? So the time for the future is now, and the time to reimagine the healthcare system is now. So I wanted to say that because I think if the funding for the healthcare system is still funding hospital beds and people waiting for 11 hours to see a doctor, there's something really fundamentally wrong with the system that can be changed now with digital technologies. But as to blockchain, and I'm going to stay with the pandemic because that's where you're seeing the real innovation. So, Nigeria has got the highest rate of mobile use of any country in Africa. So people are using mobiles for almost everything. And so you are in a situation where you're going to be able to take advantage of so many different ways that technology and blockchain can help people. So starting not at the healthcare end, but at a very important end, which I know the doctor's going to speak about, is in payments. What we've seen is some rapid innovation in payments during the pandemic, using blockchain-based systems, whether it's to get money to people who are in need, for charities to be able to distribute money directly, or for people to get paid for their insurance claims around the pandemics. People are innovating all around the world in the area of payments related to the pandemic, but that's payments innovation that can, continue well after the pandemic. A lot of the tracking of the pandemic is also using blockchain. The supply chain failures, people are using blockchain for provenance of supply chains because we started to see a lot of fake PPE equipment coming up. And then in terms of people being able to create small parts for ventilators. They started using 3D printers to create small parts for ventilators. In addition to that, there's a whole lot of ways people have been using blockchain and artificial intelligence and IoT to be able to track people remotely who are in isolation. So there's a huge number of ways in which blockchain can be used to enable us to provide healthcare better and faster and more efficiently. I'm not going to talk about the data sharing aspect of it because I know that the doctor is going to talk about security and data sharing. So I want to give him the opportunity to talk about that.
Interesting, interesting. Chicho, you've been able to hear her. So what's your own understanding of blockchain and how it can play a role in the healthcare sector?
Okay, I'll briefly talk about the role of technology generally, then I can go into blockchain technology. One of the earliest in surgery, one of the earliest times humans ever used technology or tech in surgery was far back in France for trepanning. It's a process whereby a hole is bored on the skull. So humans over time, about 7,000 years ago, have used tools and equipment to make healthcare even better. Bringing it back to this generation, like she said, innovations in healthcare sector has been rather slow because the practice is quite conservative, very, very conservative. The practitioners or the practice of medicine in Nigeria and Africa, I understand to some extent, is quite sacred. Everything is done in the closed. The doctors are held like little gods and all of that. So it's quite conservative. They are not open to technology. If you compare how transactions were in the banks and compare the world today, even looking at cryptocurrencies, you can see the huge leap in advancement in payments. But you cannot rightly say that for the health sector. Innovations were quite slow up until COVID-19 pandemic. Before the COVID-19 pandemic, when we first started the New EdX project, we were working on creating an application that could, to some extent, predict the spread of diseases like tuberculosis and meningitis. So that alone met some resistance because the healthcare sector was not open to such innovations. There were like future discussions, and whoever we speak to be like, why are you thinking about this now? The problem in Nigeria is no doctors or no equipment. Why are you thinking about this? But not long along the line, we saw the COVID-19 pandemic. And I had to go back to say, if we had this, we would have been able to track contacts very, very more efficiently and even have the records of it. So that's how technology is being perceived. But with the pandemic, there is a whole lot of reception to new innovations in technology, and blockchain has a huge role to play in healthcare sector. I'll talk about it from this aspect. The fourth industrial revolution has been rather dehumanizing. Dehumanizing, I say quote unquote, because there is more focus on blockchain, artificial intelligence, robotics, and humans have been pulled out of the equation. If you take a look, the next revolution will be how humans connect to such technologies. And somewhere, somehow, we are in between the line because we are directly in place for that to happen because we really need it to address the short supply, like telemedicine component we're building. So if you see about data privacy, you see lots of hacks, cyber criminals, hacking platforms, taking sensitive patient data. That will be curbed or can be curbed by the blockchain technology. The technicalities, I wish I had so much knowledge on how it works, but working with our CTO, I wish he was around to talk about it actually. But having information on the blockchain, I know is safer than having it on one platform just on the internet. So basically, around data privacy, you want to look at blockchain. Around interoperability as well, you want to look at blockchain technology. And around that, what we are doing as as a project, as a startup, we're working with one of the best in the world, Boss IQ, the Boss IQ platform, where the issue of privacy and data security is top of the list of what the platform is about. So basically,
did you just say Burst IQ?
Yes, that's correct.
Oh yeah, I know those guys. They're great. Frank Ricotter's a good friend of mine.
Yes, we're working with Boss IQ.
Oh, cool.
So what we're building is on the Boss IQ platform, basically.
Oh, that's so exciting. So nice to meet you.
Nice to meet you too. Yeah, so back to you. So that's what we've been doing basically.
Okay, interesting. Thank you very much. You've been able to share knowledge. We've been able to discuss the role of the importance of the healthcare sector, challenges facing the healthcare sector, and how blockchain can play a role in the healthcare sector. So moving down, we will be looking at the future of healthcare sector. We are looking at the future of healthcare sector with the application of blockchain, not only blockchain, another emerging tech. Dr. Cheche, how do you see the future of the healthcare sector with proper application of the blockchain and the healthcare and other emerging tech?
There are lots of things to consider when it comes to blockchain technology, and in societies like ours, there are lots of factors you can consider before you can say this has an impact on the nation entirely. The role and the impact cannot be overemphasized. It's outright, it's clear that we need to behave differently when it comes to interacting with technology and the healthcare sector. Yeah, can you hear me?
Yeah.
I can hear you. I can hear you. Go ahead, we can hear you.
Do you want me to answer for a bit while he's sorting himself out?
Okay, Dr. Jen, you can go ahead.
Okay, I think there's a lot of different ways that blockchain is going to be able to improve the efficiency of the healthcare sector as we know it. I want to just highlight a few features about blockchains because I think we didn't really describe it very well. And we're talking about its application, but I think there's a couple of things that are really important to understand. First of all, it's a distributed network, which means there's no central servers. So traditionally, the way healthcare and nearly all organisations that we work with have all the information centralised somewhere. An important thing about a blockchain is it's decentralised on thousands and often hundreds of thousands of computers all around the network. So there's no central point that data can be hacked, because you'd have to hack half of the computers in the network all at once. So that's the first thing. The second thing is that once the data gets on the blockchain, it can't be tampered with. So things like forgery and data integrity is really protected on the blockchain. The third one is that every time a block goes on the chain, it's time stamped. So you can't mess with that either. And it's completely auditable and viewable by all the participants on the chain. So it has a level of transparency that general centralized systems don't have. And then finally, and this is the point that's being made, is that it's very secure because all of the transactions are cryptographically secured. So that's the first thing. But in terms of the big transformation that I think is going to be taking place for blockchain and healthcare, and actually there's a Nigerian technologist based out of Kenya who's got a project doing this called Afria Record, is the personal data wallet. You know, our colleague, the doctor, was talking about how patients have to fill in so many forms and give their data. In the future, you will hold your entire health record in the palm of your hand and you will own that data. And one of the things that's becoming very clear at the moment is that data has value. So all of the big platform companies are making money out of our data every day. The future that people are envisioning with self-sovereign identity and you holding your health data is that you will be able to earn money because your data is your property. And if research companies or other kinds of companies want access to your health data, you can monetize your health data. So that's a huge difference. And it means that, let's say, for example, if your DNA is valuable to someone, the data on your DNA, it's like you own a cow or a house or a bicycle. You can kind of allow people to access that and earn money for it. So I think that's a really transformational change that is going to make things very different than they are today.
Okay, interesting. That's very, very interesting. I don't know. Ucheche may be having issues with his network. I believe he will join us before we round up because we are about to round up. So let's take some questions. It's like we have some questions on the Q and A. Okay, we have John Dunn. Say, can blockchain technology make medical fee charges low?
Okay, let me answer that question. What it can do in terms of payments is a couple of things. One is just in terms of the whole way that payments are made in healthcare. It can make them much faster and much more efficient and much more targeted, and it can be automated. So let's say that you need to go for an X-ray to a hospital because you were a suspected case of TB. If blockchain is built into the invoicing and payment system, a smart contract, the minute that your TB test has been done, your X-ray has been done, then the smart contract can execute and make sure that either your insurance company or that payment's made immediately. So there's no kind of wait time on payments, that they can be immediate. The other thing about blockchain and payments, for example, is that blockchain can enable and facilitate philanthropy and charity. So, for example, if you're a person who doesn't have enough money to pay for medical care, then people around the world who would like to assist the poor get access to medical care can make direct payments to you into your wallet so that or to the hospital to provide you care. So it doesn't necessarily make the fee charges low, but it can do a number of different things to make healthcare more efficient and payments more efficient so that it's not as onerous as it is today.
Okay, it's like we have another question. We take this one, the final question from our audience. It says, Malivel, can blockchain application in the healthcare reduce the risk in surgery? And how effective can it be in saving lives?
I think that's an interesting question, and I wish the doctor was online to answer it, but let me answer it in this way. So what it can do, so let me just focus on your medical record. So what happens in surgery often is going to be defined by any other pre-existing conditions you've got or the reason that you've gone into surgery. And what happens in my country, and I'm sure it is in your country, is over the course of your life, your medical records will be scattered everywhere. So, your medical records at birth and maybe your blood type, they're in the hospital that you were born in. If you've had X-rays or if you've had laboratory tests, the X-ray company and the lab company will maintain those records. If you've been to a doctor's surgery, he'll maintain records on you. But if you move to another city, none of those records come with you. So what it means, if your entire medical history is in one place and you can give it to the surgeon who's conducting the surgery, they can make sure that you're not being given drugs that you're allergic to. They can make sure that any information from your medical history is taken into account in the way they're managing you. So it allows for much more personalised care. So that should reduce the risk of mortality and, misevents taking place during surgery. it can also ensure that the doctors have immediate access to credible, verified information on the surgical procedures that they're going to be undertaking on you. So all of the things around you should mean that surgery can be conducted. People talk about precision medicine, so precisely for you because they know everything about you, and using the best knowledge in medical and surgical care for the procedure that they're carrying out.
Okay, interesting. Dr. Jane, you've been able to do justice to these questions. Finally, before we draw the curtain, I believe Ochecho will be able to join us. How is your organization playing a role in the healthcare sector?
Well, so I have a background in the healthcare sector, so I'm actually working, with a number of different startups and companies. That's why I was excited that Dr. Chechen was working with Burst IQ, because I know their work. But more broadly, what we're trying to do with Fintech TV is we're trying to bring those stories to people. So all the things that I've been talking to you about blockchain, about how it can help, whether it's in the pandemic or inefficiency of hospital services, and about the personal health record and those things. Most people, this is completely new to them, so they don't know anything about it. And they can't imagine how this word blockchain is going to help them in any way in their lives. So what we want to do is bring those stories out and help people understand in a trusted but kind of what human-friendly way, not in Merkle trees and all of these complicated terms that the cryptographers use, but just what does it mean for me? How's it going to make my life better? So that's our mission, is to be able to bring those stories of complicated concepts and ideas to the general population so they can see how they can benefit from the opportunities that are there.
That's interesting. You're playing a very good role with fintech.tv to disseminate information to people so that they will be able to understand. It's like Dr. Cheche is joining us. So Dr. Cheche, you're welcome back. What happened? So you really missed quite a few things we are talking about. So maybe you'll be able to tell us how are you and your organizations are playing a role in the healthcare sector? We are rounding up.
First off, I'm sorry, my internet has been very beautiful, I must say. Yes. So what we're doing basically is we're trying to address the problem on two fronts. We know the problem around inefficiency can be solved using software and all the technology we want in the world. We can talk about solving the problems of inefficiency. But my friend used to say you can't shop doctors on Amazon. You have to produce doctors, or you must find a way to make them more efficient. That's the truth. So on one end, we're building a software that can address the problem around the inefficiencies we see in our hospitals, and also move in line with trends in the health sector, like telemedicine, and all of that. We're working on that as a component. We are also looking at a practical approach to address the problems in Nigeria, or typical to Nigeria, like issues around maternal and child mortality. It's quite high in Nigeria. We understand that the only way you can solve that is to put equipment in the hands of those that can do the job. So as a startup, we are going to be forming this bridge between hospitals and the people. I understand, just to mention here, I got to understand that young Nigerians like you and I spend over 800 million US dollars annually on sports betting. And this is a country that is in dire need of a better health sector. If we can find a way that we can collaborate, why not? And blockchain and cryptocurrencies has given us that opportunity to be able to build that kind of collaboration, that everyone anywhere can invest in the health sector and benefit from that. So what we're doing as a startup is what I've just said. On one end, will be the software component, which will make the hospitals more efficient. Doctors can talk to patients even from anywhere, even from diaspora. We can have Nigerian doctors call in and talk to patients and see patients. Then on the other hand, hospitals who are going to be working with will get equipment from us. So it's a win-win for everybody, sort of. The investors get to fund hospitals, they get to generate revenue for them, and the doctors get to work in better environments with good equipment, and the whole system begins to work from ground up. So what we are doing is looking at starting from a few facilities, and if we can record some success, or when we record some success, we can improve on that and continue to improve on it. More to add, we know that data is the new oil, basically. We need more and more of this data. We need to begin to better our own data. This is something that has been fairly scarce in Nigeria. It's quite difficult for you to get accurate data on almost anything. So you see things in approximations. You are not really sure which is which. And for things like healthcare, you may not have that leverage or room to make so much you want to do. So that's what we're doing at NewMedics, basically.
Okay, thank you very much, Dr. Cheche. It's like a question came before, and the Male Aval, he is insisting that you answer this question. Maybe you can bring your contribution. Can blockchain application in the healthcare reduce the risk in surgery? Yes. So briefly, we are rounding up just in a minute. You can just touch that.
You said I should throw more light on what exactly?
There is a question on the chat box, on the question and answer box. It said, can blockchain application in the healthcare reduce the risk in surgery, and how effective can it be in saving lives?
Can you hear me?
Yeah, we are with you. Just briefly.
Okay, if the blockchain can reduce the risk in surgery.
Yes.
Reducing the risk in surgery, I may not be in a position to answer that right now, or rather I don't have enough information on that, so I would not like to just throw out a comment. But I know of a project that is also using the Boss IQ platform that is using blockchain to reduce the risk in surgery as well. But that is something it's very specific. I would not like to respond. Maybe Dr. Jane can respond to that.
She has already said something about it before you joined us back. She has already made her input.
It's rather specific. I'm not a surgeon yet, though I'm training to be a surgeon. I'm not a surgeon, so I wouldn't want to respond to such specific questions. But of course, it can be used to reduce risk in surgery.
Okay, thank you very much. It's our pleasure to have you today, even for our audience who took our time to join us today on the 20th episode of CoinNewsExtra weekly virtual blockchain and crypto panel discussion. So our panelists today have been wonderful. We have Dr. Jane Thomason. Dr. Jane, thank you once again for joining us.
Thanks for having me, and good night, Nigeria.
Thank you very much. Thank you, Dr. Cheche Ubenyi, for joining us today.
Thank you very much. I am honored.
So this program is proudly sponsored by MTech Technology and Limited Ecosystem, also by Miami University Blockchain. Thank you very much. See you next week. Bye-bye.
Thank you. Bye.
Bye-bye.
Bye.